Yo, yo, what up? I'm gonna go over midazolam, also known as Versed, which is a benzo that we give for anesthesia and for sedation. We give it for patients that are having seizures. We also give it for people for chemical restraint, and we give it after RSI in conjunction with an opioid like fentanyl, just to keep the patient sedated. We give it through IV, IM, IO, or intranasally. The dose for adult seizures is 2 milligrams IV or IM, or we give it intranasally. Then the dose is 5 milligrams. For pediatric seizures, we give zero point 0.1 milligrams per kilogram IV or IM, or we give zero point 0.2 milligrams per kilogram intranasally. The dose after RSI is 2 milligrams every 5 minutes with a max dose of 10 milligrams. And for chemical restraint, we're given 5 milligrams. Obviously, that would probably be IM. A couple contraindications are hypotension, shock, and a patient with a head injury. Also, patients with alcohol intoxication. A couple side effects. There's actually a decent amount. I'm going by the book that they gave us for class, and based on what I found online, I'll just read some of them. It says respiratory depression, apnea, bradycardia, hypotension, drowsiness, nausea, and vomiting. It can cause bronchospasms, also tachycardia, PVCs, whatever that means. We haven't gotten that far yet. Blurred vision, headache, cough, and altered level of consciousness. It can also cause. There's an antidote for benzos as a whole called flumazenil. But it is rarely given because it causes seizures in some patients. The onset time for Versed is 3 to 5 minutes through IV, 15 to 20 minutes IM. And it lasts for 1 to 6 hours IM or less than 2 hours for IV. Contraindications. I went over some of it, obviously. Hypersensitivity, hypotension, shock. Yeah. I think that's about it. Versed. Peace.